Welcome viewers. Today I have brought a very important video. We know heart attack occurs everywhere now and then. It may occur to anybody anytime. But you have to understand the heart attack occur. If you can understand, then you can take proper measure. So in this video, I have described how to understand the heart attack. However, I am Dr. J.P. Das, Director of Mausami Hospital and Principal of National Institute of Medical Science. Without killing time, let's start the video. An acute or complete blockage of a medium or large heart artery usually means you have had an ST elevation, that is myocardial infarction. A partial blockage often means you are having had a non-ST elevation myocardial infarction. However, some people with non-ST elevation myocardial infarction have a total blockage. Now, come to the heart attack risk factor. What risk factor may provide the heart attack? Number one, a man age 45 older and woman age 55 and older then more likely to have a heart attack than are young men and women. This includes smoking, long-term exposure to secondhand smoke. If you smoke, please quit smoking because tobacco causes heart attack. Over the time, high blood pressure can damage arteries that lead to the heart. High blood pressure that occurs with other conditions such as obesity, high cholesterol, or diabetes increases the risk even more. A high level of low density lipoprotein cholesterol, that is bad cholesterol, is most likely to narrow the arteries. A high level of certain blood fats called triglycerides also increases heart attack risks. Your heart attack risks may drop if levels of high density lipoprotein cholesterol, the good cholesterol, are in the standard range. Obesity is linked with the high blood pressure, diabetes, high levels of triglyceride and bad cholesterol, and low levels of good cholesterol. Blood sugar rises when the body does not make a hormone called insulin and cannot use it correctly. High blood sugar increases the risk of heart attack. Metabolic syndrome is a combination of at least three or following things: enlarged waist, central obesity, high blood pressure, low good cholesterol, high triglyceride, high blood sugar. Having metabolic syndrome makes you twice as likely to develop the heart disease than if you don't have it. If a brother, sister, parent, or grandparent had an early heart attack by the age of 55 for males or age of 65 for females, you might be in increased risk. A lack of physical activity, sedentary lifestyle is linked to a heart risk of heart attacks. Regular exercise improves heart health. A diet in sugars, animal fats, processed food, trans fat, salt increases the risk of heart attack. Eat plenty of fruits, vegetables, fibers, and healthy oils. Emotional stress, such as extreme anger, may increase the risk of heart attack. Cocaine, amphetamine are stimulants. They can trigger a coronary artery spasm that can cause a heart attack. A history of preeclampsia causes high blood pressure during pregnancy. It increases the lifetime risks of heart disease. In autoimmune condition, having a condition such as rheumatoid arthritis and or lupus can increases the risk of a heart attack. Now, let us discuss about some complications of heart attack. Number 1, irregular and atypical heart rhythms, which is called arrhythmias. Heart attack damage can affect electrical signals move through the heart, causing heartbeat changes. Some may be serious and can be deadly. The cardiogenic shock is a condition occurs when the heart is suddenly and abruptly unable to pump blood. Heart failure may be occurred by lot of damage of heart muscle tissue can make the heart unable to pump blood. Heart failure can be temporarily or long-lasting chronic. Sometimes a heart attack triggers a faulty immune system response. This condition may be called Dressler syndrome, post-myocardial infarction syndrome, or post-myocardial injury syndrome. Without warning, the heart may be stops, which is called cardiac arrest. A sudden change in heart signaling causes sudden cardiac arrest. A heart attack increases the risk of life-threatening condition. It can lead to the death, that is sudden cardiac death without immediate treatment. Now we shall talk how we can prevent the heart attack. Number 1, please follow a healthy lifestyle. Don't smoke. Maintain a healthy weight with a healthy diet. Get regular exercise and manage the stress. Certain conditions such as high blood pressure, diabetes can increase the risk of heart attack. Ask your doctor how often you need checkups. Take the medication by your doctor may prescribe the drugs to protect and improve your heart health. A heart attack is often diagnosed by emergency setting. If you have had or are having a heart attack, your doctor will take immediate steps to treat your condition. If you are able to answer questions, you may be asked about your symptom and medical history. Diagnosis of a heart attack includes checking blood pressure, pulse, temperature. Tests are done to see how the heart is beating and to check overall heart health. The tests include ECG, electrocardiogram. The first test done to diagnose the heart attack records electrical signals as they travel through the heart. Strictly patches are attached to the chest and sometimes the arms and legs. Signals are recorded as waves displayed in the monitor and printed on paper. An electrocardiogram can show if you are having or have had a heart attack. Certain heart problems slowly leaks out into the blood after heart damage from the heart attack. Blood test can be done to check all these proteins, that is cardiac marker. A X-ray chest shows the condition and the size of the heart and lungs. Sound waves, ultrasound creates image of the moving heart. This test can show how the blood moves through the heart and heart valves. An electrocardiogram can help identify whether an area of your heart has been damaged. An angiogram, a long thin tube, a catheter is inserted into the artery, usually in the leg, and guided to the heart. Dye flows through the catheter to help the artery show up more clearly on images and made during the test. Cardiac computed tomography, that is CT scan, and MRI. These tests create images of the heart and chest. Cardiac CT scan use X-rays. Cardiac MRIs uses magnetic field and radio waves to create images of your heart. Both tests usually lie on the table on the slides and inside a long tube-like machine. Each test can be used to diagnose heart problem. They can help show the severity of heart damage. Now come to the treatment of heart attack. Medication that treat the heart attack might include: number 1, aspirin. Aspirin reduces blood clotting. It helps keep the blood moving through the narrowed artery. If you call the emergency phone number, you may be told to chew aspirin. Emergency doctors may give you aspirin immediately. Clot buster, that is thrombolytics and fibrinolytics. These drugs help break up any blood clots that are blocking blood flows in the heart. The earlier a thrombolytic drug is given after a heart attack, the less the heart is damaged and the greater the change of there is the chance of survival. A medicine called heparin may be given by intravenous injection. Heparin makes the blood less sticky and less likely to form clot. The medication widens the blood vessel. The name is nitroglycerin. It helps to improve the blood flow to the heart. Nitroglycerin is used to treat sudden chest pain, that is angina. It is given as pill under the tongue, as a pill to swallow, or as an injection. Morphine is given to relieve chest pain that does not go away by the nitroglycerin. Beta blockers are the medications slow the heartbeats and increases the blood pressure. Beta blockers decreases blood pressure. Beta blockers can limit the amount of heart muscles damage and prevent future heart attack. They are given to the most people who are having heart attack. Blood pressure medicine called angiotensin converting enzyme ACE inhibitor. These drugs lower blood pressure and reduce stress of the heart. Statins are the drugs can help lowering the unhealthy cholesterol levels. Too much bad cholesterol can clog arteries. We have come at the end of the video. I hope you have learned how to understand the heart attack, and in future if anybody got heart attack, you will understand it easily and you can take the proper measures. However, I hope you have liked the video. If you have liked the video, please give a like, and if you are new in this channel, please subscribe it such that I can brought new such informative video for you. Okay, see you again within very short period of time within next video. Until then, bye bye.